So the toolkit is a series of searches which will enable practices to easily identify asthma or COPD patients who may be at high risk of complications, exacerbations or potentially death. And the searches are based on the findings of the NRAD and the COPD national audit. With the National Review of Asthma Deaths, we found that almost half of the patient deaths could have been potentially avoidable. Some of the risk factors included overuse of their reliever inhalers, so patients using more than 12 inhalers per year, patients who hadn't been given a personal asthma action plan, for example, or patients who are underusing their preventer inhalers. With COPD, it identified patients who were at risk because they had had 2 or more exacerbations in the previous 12 months, patients where their MRC scores hadn't been documented, which documents the severity of their COPD. By identifying and reviewing these patients, potentially we can improve quality of care for patients, their symptom control, but potentially also exacerbations which could lead to unplanned hospital admissions, and ultimately in some patients it could reduce their risk of death. In primary care, we all know, particularly at this time of year, we're all very busy. GP practices generally are not always the best at identifying patients through searches, etc. So by having a toolkit developed, tested, and then given to us, it actually saves us time in terms of identifying the patients. Secondly, because the toolkit has been tested and validated, we're actually identifying correct patients, and that's important. And thirdly, from a clinician's point of view, what I want to do is spend my time actually reviewing the patients rather than identifying them.
The toolkit is a sort of suite of IT searches, if you like, for the GP clinical system we have here, which is EMIS Web. And what these searches do, once they're imported in to the practice side, you can run them at any time at your convenience, and they don't take very long to run either, sort of literally seconds. And once they've run, they trawl all the data within the computer. So they'll look at all the different parameters of sort of COPDs, asthma, admissions, and how much of X inhaler and Y inhaler these patients have been using, antibiotics, steroids. So this is all done for you. The second part really is with once that data has been trawled, it activates those that are at risk that need to be reviewed, a little pop-up alert within the patient records, and that sort of acts as a prompt. Fortunately, somebody's done all the hard work on the toolkit, and the easy part really, which I found, was sort of just a quick download from the website, and straightforward to import them. And there is actually a guide there on how to import all the searches and protocols you require. This process took, I think, probably 10 minutes at the most.
We've found as a practice that it was easy to put into our EMIS system. Running the searches was straightforward. And then once we run the searches, we can then identify the list of patients. We also found that we want to use the toolkit to monitor our performance. So hopefully as we review patients, the numbers that have been identified will start to reduce.
Toolkit's been really useful in the last few months. It was minutes in terms of importing searches and identifying those at-risk patients. And what it really has helped in terms of the last 3-4 months with the pandemic, where we've had to work remotely. One, we've identified the patients, and then we've used software and IT to sort of converse with patients and conduct the reviews via video and telephone. The feedback's been really good, particularly from the asthma patients. They've sort of favoured this way of working, particularly for the stable patients, where they can reply back via SMS, email in terms of how they're managing, how they feel their asthma is in the current time. We can sort of reply back to them with links in terms of inhaler techniques, and we normally do this face to face, but that's been useful as well. So I think it has sped up the reviews and the number of patients we're getting through. Some of the things I've picked up and identified from the searches and the protocols, a couple of examples would be those patients that regularly order or potentially overuse their short-acting bronchodilators, i.e. salbutamol, sibutylene. And this one with the searches, it will identify those patients in one list. Secondly, it also prompts you with a red flag pop-up within the records as well. So it's just an opportunity really. So with sort of a little bit of education with the HCAs and the nurses as well, and GPs within the practice, it's an education prompt for when we see the patients face to face. And also we have a list now which we, from that search, have exported to Excel to look at the very high numbers. We've got a fair few number that it has picked up. So we're starting sort of high end and then working down, and then that, again, it's just sort of educational pieces for the patient as well, and sort of managing their asthma.
We know that there are a significant number of patients, particularly with asthma, for example, who don't tend to come for reviews, even though we invite them. So one of the things that we found is that contacting these patients after identification through the toolkit, for example, through a telephone consultation, has actually worked quite well with patients, because they're happy to talk to us on the phone. We can still get a good idea of their symptom control, and we can also then incorporate their own personal asthma action plan as part of that consultation. And we can then document, and the patients can have their own self-management plan sent to them. And we're hoping that by doing that, we can actually, one, improve their symptom control, but secondly, reduce their chance of having exacerbations. I think the big difference is it's a systematic approach to identifying high-risk patients. And by identifying those high-risk patients, we can devote our resources better, and also by using the new mix of video, telephone consultations as we're doing in the COVID era, we can actually make better use of our time as well.